Of course, there are some other clinicians will say, oh, if the impaction is like that, you can just cut. You can just cut here, and then the impaction is not there. You can elevate out. Yeah, you can do that, but then you will need to learn so many styles to fit so many impactions, which is not necessary lah. So as a student and as a young dentist in the future, first you would have to use the Peterson's index, difficulty index. Peterson's difficulty index has got 3 components, if I'm not mistaken: level of impactions, depth of impaction. Is it supra level, as in same? If the crown is same level as a 7, then it's a bit easier. If the crown is between the occlusal surface and the CEJ, is usually where the teeth are impacted. And the third one is where the crown is below the CEJ of the 7. So that tells you that it's a bit deep. And then the third component is how deep is the tooth inside the ramus. You know, is it if the mesiodistal width, okay, can you imagine the oblique ridge, the mandible oblique ridge, from that point to distal to the 7, that is the space for your 8 to erupt. If that space is less than the mesiodistal width of your 8, so they will calculate that lah. If your tooth is all the way inside the ramus, then you have to remove a lot of bone. Basically, difficulty comes with how deep is it below, how deep is it inside the ramus, and how much of bone you have to remove. So those are the 3 what they call it, factors for Peterson's difficulty index. However, it's not the only thing. What else you think is important? The nerve. How close is it to the nerve? That is a 4th factor. So there are 7 signs. Is it touching the canal? Is the canal change angle? So they got tooth factors, they got canal factors. Canal factors means narrowing of the canal. The inferior alveolar nerve comes from the lingula, and then after that it goes in. So when it's very close to the nerve, the canal narrows.